The fourth part,
they're not very pro-vax,
of Joe Rogan on chiropractic in the United States.
Chiropractic medicine.
If you haven't seen the first episodes,
Holy fucking shit. Not only do I not feel bad now I'm angry.
go listen to them.
Why the fuck are you manipulating babies? Just
Because they will provide a lot of context.
they're not very pro-vax. And I mean, their language on it is under the condition of freedom of choice.
Indeed, many chiropractors in the United States, from the early days of chiropractic to this day, adhere to a very popular anti-vaccine movement for all the reasons I've discussed since the beginning of this series. In the United States, due to the socio-political climate, the pseudo-scientific and religious aspects of the power of subluxation and correction through chiropractic manipulation to improve all functions of the immune system and health in general. Some chiropractors tell their patients that if they are adjusted regularly, their body will be better equipped to defend against diseases. This is pseudoscience and goes against the scientific evidence available regarding vaccination and its global benefits.
Medical choice, and it's like they don't say straight out vaccines don't work, they're bad for you.
I can assure you that there are chiropractors who are very vocal about this. They often gather in echo chambers on Facebook or other less regulated platforms where pseudoscientific messages that can harm public health spread easily. However, these discourses are still present in private practices, often in an exaggerated manner and more discreetly, even insidiously, in public speeches in order to avoid backlash from the traditional healthcare system and the medical board.
They're wishy-washy on it, and they don't say vaccines work and you should get them.
Because if they acknowledge that vaccines are effective, it would call into question the impact of chiropractic adjustments and the claimed benefits of correcting subluxations to maintain homeostasis and maximize optimal health.
But a couple of chiropractors will try to say we don't need vaccines. We can increase your immune system. We can increase your immunity by, pressing on the spine.
There's zero evidence.
Zero evidence.
Not only is there no scientific evidence to justify such discourse, but it would also be dangerous to propagate such inflammatory ideas. The more the percentage of the population immunized by vaccines increases, the stronger the barriers against the spread of diseases become, which reduces the risk of epidemic outbreaks. Furthermore, this protects the most vulnerable individuals who cannot receive vaccines and who, if they contract the disease, are at much greater risk of suffering from severe complications than the general population.
And I'm like, do me a favor, tell me which part of the spine you press on to give a child immunity to measles and polio. Give me the titers. Test that child's titers to show me that they're immune to polio now from you touching their goddamn spine.
There is absolutely no scientific evidence to support this kind of discourse, and I can understand his frustration with chiropractors in the United States who spread such ideas. These views completely contradict current scientific knowledge and systematically harm the health of patients who believe them, both in the short and long term.
Maybe it's like, how about this? How about I'll punch you in the back? I'm not going to punch a chiropractor. How about I just, nod, just give you a few little, little pokes in the back, and then you're going to be immune to smallpox. Just let me know how that works. But I can't get behind a system that has no evidence and tells me it's going to make children immune to deadly diseases.
Indeed, it's frustrating. And I understand that over time, this person develops a negative attitude toward the entire chiropractic profession in the United States.
Here's the real question. How did it get this far? Like, how did this guy, who's a magnetic healer, who had no background in medicine, come up with this system and then have it spread all over the world?
This question is complex and weighty, as several factors contributed to the rise of chiropractic. What patients experienced at the time and what largely explains the increase in chiropractic consultations is that it was often the first time they encountered a healthcare professional who truly listened to their concerns, who was attentive, and who offered, in their misguided perception, concrete solutions for a cure or a way out of a bad health situation. This was in contrast to medical doctors who, due to time constraints and lack of resources, practices were often unable to provide clear explanations or reassure their patients about their conditions. Patients often found themselves with little information or practical advice for managing their health on a daily basis. In this context, chiropractors, with their claims about the benefits of chiropractic adjustments and the correction of subluxations, began to stand out. Chiropractic schools played a significant role in spreading these ideas, focusing on subluxation, adjustment, and nerve flow in an almost religious manner, without encouraging critical questioning of these concepts. As a result, chiropractors trained in these schools repeated the same messages, often in a sectarian manner. This led to the rapid growth of the profession during that time. Over time, regulatory mechanisms were introduced to curb excesses and align chiropractic practice with more coherent and realistic guidelines. However, these adjustments were met with resistance from some chiropractic purists who continue to advocate for a treatment approach centered on broader beliefs about subluxation rather than focusing solely on the relief of neuro-musculoskeletal pain.
It's such a good story, isn't it? People love a story that says that you can heal them without taking dangerous drugs. And at the time,
but forget about dangerous drugs. I mean, even just helping you with anything.
It's partially because of when it came up, because we only found out 50 years after this that frontal lobotomies were a bad fucking idea, and that thalidomide was going to kill babies. So we were really fucking bad at medicine when this came up, and we're way better at it now, but we still don't have the answers to everything. And that's kind of, I don't want to say a failure of the medical system, but it's just a sign of where we are now. So
not only does this reflect the current situation, but it also creates cracks in the traditional healthcare system where pseudo-health representatives can exploit these gaps by offering pseudo-scientific certainties and preying on vulnerable individuals left behind, taking advantage of the system's shortcomings.
Think about the number of people who have sent us anecdotes saying, I was in miserable pain and my chiropractor was the only thing that worked. And it's like, maybe you needed to get to physical therapy for longer term pain. But
once again, we can see this person's complete misunderstanding of what we know about chronic pain. It is essential to remember that for people suffering from chronic pain, there is no miracle cure. Conservative treatments like chiropractic or physical therapy may, at best, offer temporary relief by reducing regional sensitivity. This means they can help ease pain after physical and psychological overload, but chronic pain will always remain at a more or less constant level. No matter how long you seek chiropractic or physical therapy or follow the best protocols for strengthening, massage, mobilization, or manipulation, it won't change your chronic pain baseline. There simply isn't enough evidence to support this type of claim publicly. Managing chronic pain relies on self-management techniques, meaning the patient needs to better understand their pain, accept it, and implement strategies to become more active and mobile, respecting their movement tolerance and gradually increasing activity levels rather than remaining sedentary.
These people that are still going to their chiros, it means they're still in pain and they should go to a physical therapist for, a couple months of therapy that will eventually strengthen their backs and take care of those issues and, get a massage. But they're going to their chiro because medical has not said, we don't have a tricorder that can scan you, show the exact thing and say, here's the exact medicine, drug, and thing that will fix you.
When it comes to chronic pain, there is no miracle solution. Those who claim to have the key to solving your chronic pain issues are often predatory individuals, using appealing beliefs and therapeutic promises to lure you into their grip, solely to extract as much money from you as possible. Otherwise, it is simply therapeutic naivete.
It's kind of, and I hate to use this term, but it's out of the failures of the medical system that something like this has shown up. So we're not perfect at medicine yet, and that's why alternative medicine swoops in with bullshit.
That's all for this one, as the rest of the podcast just goes around in circles on topics already covered in previous episodes, and I don't want to become too repetitive. Anyway, feel free to share your story, comments, suggestions, or simply if you have any more questions.